sure that you've heard of HIV, but do you know exactly what it is? I'm going to start by breaking down the word. H, human. I, immunodeficiency. Immuno meaning resistant against disease, deficiency meaning lacking or failure. V, virus. HIV is a virus that results in a human failure to resist disease. It weakens our immune system by destroying the cells in our body that fight off infection. HIV does not necessarily always lead to AIDS, but AIDS will indefinitely lead to death. Indefinitely. HIV is a lentivirus. Lentiviruses are part of a larger group of viruses called retroviruses. Lenti literally means slow virus because it takes such a long time to produce an effect in the body. Other lentiviruses can be found in animals such as sheep, cats, horses, and cattle. But the most interesting lentivirus is the simian immunodeficiency virus, also called SIV. This can be found in monkeys. It's believed that HIV is a direct descendant of SIV because the strands are closely related. The origin of HIV and AIDS has been a debate for many years, since it first came to light in the early 1980s when groups of homosexual men from California and New York were becoming ill with rare opportunistic infections such as pneumocystis pneumonia and cancers such as Kaposi sarcoma. No one knew exactly what this disease was at the time, but they did know that all of these men were suffering from a common syndrome. At the time, HIV did not yet have a name, nor did AIDS, so its relation was undiscovered. So many people believed that this disease process was strictly a gay man's disease. So they called it GRID, gay-related immune deficiency, or they called it the gay plague. They didn't realize at the time that HIV had been around long before the 1980s and that it is a non-discriminatory disease.
HIV began to spread rapidly from mid-1970s to late 1970s, but because of its long incubation period, the virus epidemic spread undetected. In 1983, French researchers isolated the virus and believed it to be linked to AIDS, therefore named it lymphadenopathy virus. Then 1 year later, an American scientist claimed to have found the same virus and named it human T-cell lymphotropic virus type 3. And then in 1986, the International Committee of Taxonomy renamed the virus to what is now known as HIV. Later that year, a second strain of HIV was found in West Africa. Researchers believed it had been present there for many years. And in order to distinguish between the two viruses, they named it HIV-1 and HIV-2. HIV-1 and HIV-2 are spread the same way, and they even have the same signs and symptoms. But HIV-1 is more toxic, and HIV-2 is less infectious during the initial stages of infection.
So, where exactly did HIV come from? Well, there's three theories that seem to be recurrent. The first is the hunter's theory. Not the ridiculous story that some hunter screwed a monkey, even though it's possible. This theory suggests that the SIV virus was transferred to humans through the killing and eating of the infected chimps, or by their blood getting into the wounds of the hunters. This is called zoonotic transmission, meaning an organism that is able to be crossed from animals to humans. Other examples of zoonotic transmission are the anthrax virus and the West Nile virus. The second theory is the oral polio vaccine theory. In the late 1950s, the oral polio vaccine called Chat was being tested and given to about 1 million people in the Belgian Congo and Uganda. It's believed that this vaccine was being harvested in the kidney cells of the local infected chimps. 1 or 2 HIV cases can be traced back to this. So the last theory is the conspiracy theory. It's one that I've heard since I was young. Apparently, large numbers of African Americans believe that the HIV virus was created by our government as part of a biological warfare program to eradicate large numbers of black people. But my thing is this, like, if that was the case, they could have left us in Africa. I'm just saying. So, although none of these theories have been definitely disproven, none of them have been definitely proven. So, I honestly don't believe anyone knows exactly where HIV comes from. But we do know how to prevent it. So, we should focus on that because each and every one of us is just one decision away from becoming HIV positive.
I'm going to talk to you about HIV and the effects it has on the body cells. Every healthy person has 600 to 1200 T cells per cubic milliliter of blood. These T cells, also known as helper cells, are a type of white blood cell that helps the body's immune system fight off infection. HIV binds to these cells where it can travel into the lymphatic system and begin replicating itself. The virus enters the T cells when it binds with it, ejecting 2 copies of the virus's RNA. Once inside, HIV changes the viral RNA into DNA. This new cell begins making copies of HIV by using viral proteins. This affects the progression of the disease because there will be more T cells being attacked by HIV, resulting in the depletion of the immune system.
Worldwide, sexual intercourse is by far the most common mode of transmission for HIV. It occurs from human to human through contaminated blood, semen, cervical-vaginal secretions, and breast milk. It can also occur from mother to a fetus, referred to as vertical transmission. It happens during pregnancy, delivery, and postpartum breastfeeding. The 3 most common modes of HIV transmission are anal or vaginal intercourse, using a contaminated drug, or, like I said, from a mother to a child. It cannot happen through kissing, sharing food and utensils, or hugging.
Well, we were working in a trauma center, 2005, up in northern Florida, and we had a trauma patient that came in. The patient later passed away due to injuries from his trauma, but the patient had AIDS. And during while we were working on it, the trauma room was overcrowded, and I had an occupational exposure and was infected with the patient's HIV virus. Immediately after that, occupational nurse came down, drew my baseline labs, and basically we went from there. Initial labs came back as negative. 3 months into it, the labs came back negative. At 5 months, they came back inconclusive. At 9 months, they came back inconclusive. And people in northern Florida, they couldn't figure out why they were coming back inconclusive, so they decided to refer me to the Mayo Clinic in Jacksonville, where I went there, and it was, I think, Christmas or January. Would have been January of 2006 at that point, that a positive diagnosis came back. They took the labs, sent them to Rochester in Minnesota, and a day later I had a phone call from the doctor there.
When I was first diagnosed, it was November 21st, 2007. I found out 3 weeks before, which was the first week of November, that I was pregnant with twins. And so I made a prenatal appointment with the doctors. By then I was living in South Carolina with my new husband. I was a newlywed. And went to an appointment the 21st, which was the day before Thanksgiving of that year. And went in for being dehydrated. I kept throwing up and just not feeling well. And when I went in, she had already did labs. So she said, okay, well, I have your labs back. And I said, okay, well, is everything okay with my labs? And she said, oh yeah, everything's fine. We just have one problem. And I'm like, okay, what's the one problem that we have? Is it diabetes? Because I've had gestational diabetes with my 8-year-old. She's like, well, no, can we ask your husband to step out of the room? So I'm like, okay. So she asked him to step out. She basically just looked at me and said, you tested positive for HIV. And I kind of got into a blank stare. I looked over at the wall because that was really the only thing I wanted to focus on. I didn't want to look her in the face. I didn't want to, I was completely in shock, along with not feeling well. And she said, well, do you want us to bring your husband back in the room? I say, sure, bring him back in, because guess what? If I'm HIV positive, he's the reason why. So she brought him back in the room, and I can remember that day as if it happened yesterday. He just looked in shock when she told him, and it wasn't a shocked look as if, oh, she could have given me HIV. It was more of a look like, wow, she found out.
You already know what it be, level 3, and I'm here to talk about some signs and symptoms of HIV, which in reality is kind of misleading because HIV doesn't really have a specific sign or symptom that's going to tell you, okay, this person has HIV due to this. No. HIV is more like a virus that attacks the immune system and may or may not lead to AIDS. People who are infected with this virus often don't know or realize that they have this virus because there are minimal or sometimes even no symptoms at all. Due to the fact that HIV does impair the individual's immune system, therefore AIDS may cause some pneumonias and other symptoms as far as nausea, fever, chills, rashes, vomiting, ulcers in the mouth known as oral thrush, fatigue, muscle aches are very common through this disease process due to the fact that it's just bombing down on your immune system. But then again, the chronic phase or latency, which is the period where the virus stays less active in the body but still remains present, can last up to 10 years or even more. And along with all the strong medication and all the sophisticated medication that we have now, you may never experience any signs and symptoms at all of HIV.
There are several different ways you could get your HIV test. You have your blood test, your oral swab test, and your urine test, but those are rarely used. The most common test is the blood test. And to get that, just go to your local clinic or doctor's, get your blood drawn, and a week later come get your results. Getting tested for HIV is extremely important, and do not take it lightly.
Killed me, so I killed her. Chilling words from a man suspected of killing a woman after she told him she was HIV positive. Teresa Woodard has the story.
We put the bears, some of the candles.
A little show of respect in front of a now boarded up South Dallas apartment where Cicely Bolden lived with her 7- and 8-year-old children who found her body.
Kids came home around 3:30. They walked inside the house. They came out crying. I ran out to see what was wrong with them.
They were screaming that something was wrong with Mama. So neighbor Latoya Arnett went in and saw Bolden stabbed to death on the bedroom floor.
All I know is she didn't deserve it, and her kids didn't deserve to see her like that.
Arnett says she saw this man, 36-year-old Larry Dunn, arrive at Bolden's apartment Thursday afternoon. She didn't recognize him. Police say Dunn and Bolden recently started dating. He came over Thursday, the two had sex, then, he tells police, Bolden revealed she is HIV positive. The arrest warrant says Dunn was upset, went to the kitchen, got a knife, and stabbed Bolden to death. He said, quote, "She killed me, so I killed her."
I can't imagine my kids seeing me like that. So I know it hurted them.
Teresa Woodard, KENS 5 Eyewitness News.
A combination of active retroviral therapy is an important component of the HIV infection. The U.S. Food and Drug Administration has approved 20 antiretrovirals. 6 of them are used in the replication process. There are a few drugs that I can list right now, and some of them are the fusion inhibitors, CCR5 antagonists, the non-nucleotide and nucleoside reverse transcriptase inhibitors, the non-nucleotide and reverse transcriptase inhibitors, and each of these medications interrupts different stages of the HIV infectious process.
There are many different ways you can prevent HIV. For one, educate yourself. Find out what HIV is and how it is transmitted. Always use condoms when having sexual intercourse. Never reuse or share needles. And get tested regularly. It is important.
The average time for HIV infection to progress to AIDS is 10 to 11 years for those who do not take antiretrovirals. In a person with a very high HIV viral load, AIDS may develop sooner, within 5 years. After infection has progressed to AIDS, there is an increased risk of death that varies dramatically from person to person. For example, a person with AIDS have died shortly after they were diagnosed, to whereas others have lived 12 years or more. Because very potent medication against HIV have only been available since 1996, we do not yet know how long a person will live with the HIV infection. If they are tested early and treated appropriately, however, the outcome is very good, especially for those who began the antiretrovirals at an early stage of the disease. If you are infected with HIV, it is good to get tested early or to find out early so that treatment can be started before the immune system is weakened. Since potent antivirals became available in the United States, there have been a dramatic decrease in AIDS-related deaths and hospitalizations. However, in some of the developing world, there still is a lot of AIDS-related deaths due to lack of life-saving antiretrovirals.
And the tears come streaming down your face when you lose something you can't replace. When you love someone but it goes to waste, could it be worse? Lights will guide you home and ignite your bones, and I will try to fix you. I'm high up above or down below, when you're too in love to let it go. But if you never try, you'll never know just what you were. Lights will guide you home and ignite your bones, and I will try to fix you.
What would I do if I found out I had HIV? To be honest, I don't know. I think I'll just be in denial for a long time. But after a while, I will want to go get medicine to live longer for my kids. And also, I will want to teach others the many ways they can contract HIV and how to wrap it up and take precaution at all times.
If I found out that I was HIV positive, I think my initial reaction would be shock and then denial. I would be angry at everyone, the world, the healthy people, God, because I feel like I would have got cheated out my life. I would be afraid to tell my family because I know something like that would devastate them, especially my mom. I don't know. I don't know what I would do if I was in that situation. I just hope and pray I will never be in that situation. So I guess, I don't know. I guess I would just try to live, man. Just live happy. That's it.
And for the record, what would you do if you had HIV?
If I found out I had HIV, I would be devastated. I would be thinking of my daughter. I'd be thinking of all the things I'm going to miss out on. And I would probably think, unless I'm Magic Johnson or I buddy up to him, more than likely it's probably going to turn into full-blown AIDS at some point. And I won't be around for half the things that I'd like to see with my daughter as she grows up.
Okay.
If I found out that I was infected with HIV, the first thing I would do is cry. I wouldn't know what else to do. I would probably, well, I know for a fact that I would be in denial. I would feel disgusted. I'll go into a deep depression and think about doing things that I can't list on camera right now. I would try to find out ways or figure out a way to tell my family. And that's all.
If I had HIV, I would kill the person who gave it to me, and then I would try to live my life the way I would have never imagined to live it if I didn't have HIV.
What would I do if I had HIV? I don't know. I'd probably be on America's Most Wanted. What would you do?
Quagmire. Thanks, honey. Say hi to your husband. Oh, I got AIDS again. Better take my NyQuil cold flu and AIDS. All gone.
Hey, listen, there's something you should know.
What's that?
I have this disease that kind of makes your immune system sort of go away.
Oh.
Yeah, it's probably nothing, but I just thought I should tell you.
Oh. Okay.
Otherwise, I am clean as a whistle.
Oh, great.
Hey, thanks for not making me wear a condom.
Oh, yeah, no problem.
Want to go again?
Let's pound it, brother.
How come no one's buying your hotcakes, Mr. AIDS?
Because I'm Irish, Jimmy. Because I'm Irish.